Okay, welcome to the Home Together Investment Plan, Local Solutions to Homelessness virtual town hall meeting. We'll be here for a little over an hour, up to an hour and a half tonight. We do have a hard stop at 6:30 p.m. My name's Carrie Abbott, and I'm the director of Alameda County's new Office of Homeless Care and Coordination. I'd like to welcome and thank you for joining this virtual town hall to discuss the Home Together Investment Plan for local solutions to address homelessness. We're conducting today's meeting remotely via teleconference in response to directives issued by local and state health officers regarding the COVID-19 pandemic. Meeting participants on this teleconference will be able to ask questions and provide comments following our initial presentation. Later in the meeting, before our Q&A period, we'll provide brief instructions on how to verbally participate. Please note that this meeting is being recorded. To kick off our meeting, I'm going to turn this over to Supervisor Scott Haggerty of District 1, who will give us a picture of the impact of homelessness in Alameda County. Supervisor Haggerty, thank you and welcome.
Thank you, and welcome to everyone, and thank you for joining tonight and participating in this community town hall on homelessness. First of all, thank you to our host, Carrie Abbott, our Director of Homeless Care and Coordination, Alameda County Healthcare Services Agency. I've been dealing with Healthcare Service Agency all day today. It's been loads of fun. And Gloria Bruce, Executive Director of East Bay Housing Organizations, and of course, Sharon Cornu, the Executive Director of St. Mary's Center. As said, I am Scott Haggerty. I've been honored to work and for this community for 23 years, representing Fremont, Livermore, and Dublin, much of the unincorporated areas in Alameda County. In that time, I've seen amazing growth. I've watched the community come together to make difficult choices and find ways to address the changing needs of our families and our neighbors. That time has come once again. So thank you all for being here tonight. The number of our neighbors that are experiencing homelessness has grown exponentially in the last few years. We have seen specific growth in housing instability for our seniors, families with children, veterans, unaccompanied youth, and young adults. The point in time count in Alameda County jumped from 4,040 people in 2015 to 5,629 people experiencing homelessness in 2017 to over 8,000 in 2019. So we've doubled. Over 8,000 people are experiencing homelessness tonight in our county. And the numbers keep growing. 1,200 were counted in District 1 last year, and we know that number has been growing. The vast majority of people experiencing homelessness, both families and individuals, are from our own community. And I want to stress that these homeless people are from our own community. These are our residents and our neighbors. The count shows that around 83% of these community members were living in Alameda County for over a year before losing their housing. 57% for over 10 years. Many families and individuals experiencing and at-risk homelessness have jobs but aren't able to afford housing. Good people are losing their homes for a variety of reasons. The highest numbers, at 13%, are people who lose their homes because of lost jobs or significant decrease in wages. The reality that is being faced by more people today than last year. 18% face evictions, foreclosures, or rent increases. 12% are suffering from mental health issues, and 10% substance abuse or addiction issues. We've also seen that when our community members return after incarceration, they're returning to a changed and very unstable conditions. When asked what might have prevented the loss of home, the primary areas identified were rent assistance, benefits, income, employment assistance, and mental health services. Housing instability has reached a level of crisis. This has been pointed out even more clearly during this pandemic. More and more of our families and neighbors are at risk for losing their homes, not just now, but in the coming months. We need rent assistance rent assistance is skyrocketing. Each day, more and more of our community members are feeling the impacts of lost jobs, cut hours, layoffs, and furloughs. And for all the efforts of our local government, we know that people are falling through the cracks. We know these most likely to fall through are senior citizens, people with disabilities, and those on fixed incomes, young children, veterans, and those who have additional hurdles. Very low income individuals and families who are already at risk of losing their homes are the most vulnerable during the current public health crisis and will have the steepest climb to recovery. The hiring process is out of control. Rent continues to increase. Suicides and mental health crisis among veterans is growing at an epidemic across our country. The lack of mental health resources leaves our community members without the support they need, leaving law enforcement and first responders to respond to these mental health emergencies. For every 3 people who become homeless, only 1 returns to housing. To combat this, we need a stable stream of funding that will stop further internal displacement, keep our families and seniors in their homes, and shelter those who are experiencing homelessness. Provide additional funding to community-based solutions to homelessness. Provide appropriate mental health services and support for those who need it. Provide resources, treatment, and support to our veterans. And prevent local residents from losing their homes and experiencing homelessness in the first place. As I said, I have seen this community come together during hard times. I have seen us achieve great things, and right now our community is inspiring me with the depth and breadth of the response to this current public health crisis. I want to thank those who are out now and actively fighting for health and the dignity of our unhoused shelters, our neighbors. To all the veteran volunteers and outreach of staff, to the team of case managers, shelter workers, and staff at hotels who are sheltering those who are most vulnerable. The amazing community at Ashbury and the public sewer and laundry, shower and laundry facility. The hundreds of volunteers who have stepped up to staff our food banks and deliver meals. The community who has come together and do outreach at curbside communities and encampments. The paramedics, the firefighters, the medical staff, and all those doing the testing, supporting the efforts. Thank you. Can't thank you enough to our nurses. I also want to thank the unhoused community for participating, for finding ways to shelter and work with us during this time of fear and anxiety for many. I want to thank all the people with more than words. I just want to provide a reliable stream of funding so next time the crisis hits, we are better prepared. We have woven a community-based safety net here in the time of a crisis. We can make these supports more sustainable, which is why we are here tonight to learn about the ballot measure to accomplish this. So again, thank you for all for being here, and thank you for caring about this great community. Now I'll turn it back to Carrie.
Thank you so much, Supervisor. I'm going to go ahead and review the agenda and go on to our speakers and presentation, and then we'll have a chance at the end to ask Supervisor Haggerty some questions and give him another chance to speak to the issue. So the first section, welcome and introductions, that's where we are now. Next, we'll have the path and process, why we're proposing a ballot measure. Third, we'll have the ballot measure proposal, the question and answer, and then we'll go a little bit into next steps, where we're going from here. Next slide. So today's presenters, I'll start. I'm the Director of Homeless Care and Coordination with Alameda County Healthcare Services Agency. After that, Gloria Bruce will be speaking. She's the Executive Director of the East Bay Housing Organizations. And then we'll have Sharon Cornu, the Executive Director of St. Mary's Center. I also want to acknowledge that there are a great many people who have helped us get this far, including Supervisor Haggerty's colleagues on the Board of Supervisors. They unanimously asked us to work on framing a revenue measure. People who served on our policy community, from the nonprofits, and people with lived experience who have been helping us to inform this work all along. So I want to talk about why we're here in the middle of a pandemic talking about a revenue measure. And I want to acknowledge that it's a hard time to be thinking about what we're doing in November when we are still sheltering in place and still many of us struggling with where we are right now. But the COVID-19 pandemic has made even clearer for many of us how vulnerable people are when they're unsheltered. And it's made much clearer how vulnerable people are when they are in congregate shelter. In a pandemic like this, only having a place with a restroom and where you can close a door is an effective way to shelter in place. And we have thousands of people who are not able to do that right now. So it has really hit home how much more we need to do. That's why we're continuing to run these town halls and get input and move forward during COVID-19. We also know that for many people in our community, homelessness continues to be a top priority, and that now more than ever, we're going to have a lot of people who are going to be at risk of homelessness based on job loss and the other economic factors. So we have decided that we're moving forward and that we want to ensure that we have a sustainable way to support solutions to homelessness in Alameda County. I'm now going to turn the presentation over to Gloria Bruce, Executive Director of East Bay Housing Organizations, to talk about homelessness in the county. Thank you.
Thank you so much, Carrie. And thank you, Supervisor Haggerty, for those opening words and hosting this tonight, and for your support and leadership on this developing measure. So as Carrie mentioned, my name is Gloria Bruce. I'm the Executive Director at EBHO, East Bay Housing Organizations. If you don't know us, we've been around for several decades, and we are a membership coalition working to promote creating and preserving affordable housing across Alameda and Contra Costa County. So we're based here in Alameda. And I'm here for EBHO, but I'm also here tonight in my capacity as a leadership board member of Everyone Home, and standing in for AlamedaCountyCA, who I know many of you know with Everyone Home. And I'm going to talk a little bit about how we got here and who's been behind this effort to date. And I want to kind of convey two themes with that. One is that there's been a lot of thought, a lot of input, many people in the conversation, including some of you on the webinar tonight. And at the same time, the reason we're having these town halls is because there's a lot of opportunity to continue to shape and weigh in on and spread the word about the framework that you're going to hear about. So again, I'm here on behalf of both EBHO and Everyone Home. And you can probably hear my kids in the background. Sorry about that. Everyone Home is Alameda County's collective impact organization and also the Continuum of Care lead agency for the county. And very glad to be co-hosting this session today with Alameda County Supervisor Scott Haggerty and Carrie and the Office of Homeless Care and Coordination, as well as St. Mary's Center. We really want to make sure that this input from all of you stakeholders and residents is used to shape the Home Together investment plan that we hope to see on the November ballot. Everyone Home, some of you may know us because we conduct the biannual point in time count that leads to the data that you heard a bit about. And we also engage in critical countywide planning activities with the singular goal of ending homelessness in our communities, and doing that through housing. We recently released a countywide plan to end homelessness, which publicly called for the need for a dedicated revenue stream. We're now conducting needs analysis and racial equity work groups with technical assistance from HUD so that we can truly understand what resources it will take to end homelessness in our county. Now, the next slide that you're going to see has some numbers and data from the last point in time count. There it is. And Supervisor Haggerty touched on some of this. I see some of your names. You're very knowledgeable about all this, and anyone walking around and visiting the county can be knowledgeable about this. I know me being in shelter in place and not leaving the house sometime for days at a stretch, when I do go out to get groceries, I'm sort of shocked anew at how many people I see living outdoors. And we should be shocked. It shouldn't become normal at all, but unfortunately it is becoming more and more a reality. As you can see from this slide, the individuals experiencing homelessness in Alameda County has doubled since the 2015 point in time count, with over a 160% increase in unsheltered homelessness. People who are now unhoused or experiencing unsheltered homelessness are now 79% of that population on any given night. And that was a 39% increase over the 2017 data. One thing that's really important for us to note is that African Americans, Black communities, Native Americans are experiencing homelessness at a rate 4 times higher than those folks exist in Alameda County's general population, and more than double our rate among people in poverty. Research shows that racial disparities in the homeless population are the results of centuries of structural racism and laws and practices that have excluded historically oppressed people from equal access to housing, community supports, and economic mobility. And that's why our strategies to combat that have to be intentional about addressing those racial disparities and heading towards equity. With all those numbers and situation in mind, we convened hundreds of stakeholders between July 2017 and September 2018, including many of you, to think together what was needed, and we released the updated strategic plan in 2018. So on this slide, you can see one giant and unfortunately not great takeaway from all that analysis. I mean, one thing is that this county is doing the best job it can, a good job of getting people to exit homelessness and enter permanent housing. But the problem is that there are so many folks who are newly homeless. So the people on the left, you can see that the purple people there, those are the ones newly becoming unhoused or homeless. And then the gray group on the right are those leaving who are actually finding permanent housing. And unfortunately, at the time the plan was done, for every 1 person exiting homelessness, 2 more people were becoming newly homeless. And now in the 2019 data, that ratio is more like 1 person exiting for 3 people coming in. So you can see that group in the purple on the right. It's just too big for us to keep up. And that's what we really need to reverse. So this next slide kind of summarizes some of the main strategies and system needs that we've identified to do this, to reverse that trend. Communities have been feeling the impact. We've seen unsheltered homelessness visibly on the rise, and people have been responding. There's grassroots organizing, mutual aid, action plans, partnerships, funding. We've seen new curbside communities, navigation centers, community cabins, safe parking, and new state funding such as HEAP, and also some local measures such as the Fremont Navigation Center. But the fact is, everybody's being asked to do more to solve the problem of homelessness without the necessary resources, and that's the reason why we need this measure. Several jurisdictions have released plans calling for increased efforts to address the problem, and all of them say comparable things, kind of summarized by these 3 themes. And for anyone who doesn't have the visuals in front of them, the first theme is that we have to prevent people from becoming homeless. Let's shrink that number of the folks in the purple who are coming into the system. Do more to keep people housed, and target prevention to people most likely to become homeless, especially important now with so many people facing increased economic stability with COVID-19. The second thing we have to do is house extremely low income people. 42% of the adult population is on a fixed disability or retirement income, which puts them at about 11% of what's known as the area median income, or AMI. And these extremely low income people cannot afford permanent housing without deep subsidies, some other source of support to pay their rent. Finally, we need to achieve safety and dignity for people experiencing homelessness. So we need low barrier, short-term interventions such as shelter, safe parking, and outreach and hygiene stations to protect safety and dignity. And these needs were identified and detailed in a recently conducted needs assessment. And of course, COVID-19 has only highlighted the gaps in the needs even more. So where does this leave us? This is what brought us again to the idea that we need a dedicated local revenue stream to close this gap. We've made it clear that even though our systems, and many of you are working every day, it's not adequately resourced for the scale of the problem. We saw that in fiscal year 2017-2018, the county was spending approximately $106 million a year, but we estimated that the resources needed were closer to $330 million a year, and we know now that the need is likely even greater. So this is why we landed on a revenue stream approach. And I should say that, I should have mentioned this earlier, that the county has a good recent record of saying yes to funding homelessness and funding housing and solutions to homelessness. And part of the reason why my organization, EBHO, is involved is because in 2016, we were very involved along with Everyone Home in pushing for Measure A1, which was a $580 million bond that is producing housing as we speak, including behind me, Casa Arabella, which is in Oakland. Supervisor Haggerty and his colleagues were very supportive of that. And so this county has a history of saying yes, getting it done, passing a revenue measure. And what we need to do now that we have those bricks and mortar through A1 is boost the resources and bring them to the strategies we talked about before. So the strategy we've currently landed on is a sales tax, which is proven to be the most viable option to raise the level of revenue that we would need to provide solutions. And we estimate that a half-cent sales tax, earlier estimate was about $150 million a year to help close that gap. So the next thing I'll just share before I go back to Carrie is just who were the groups and stakeholders involved in the development of this measure. So first of all, there have been service providers involved throughout. The Alameda County Board of Supervisors, starting in October of 2019, supported developing a measure for the ballot and started working with that service provider network and many other key stakeholders, including many of you here. So in addition to an informal network of service providers, also, of course, the continuum of care represented by Everyone Home, which has been working on this hard for a long time. There's also been a group called the Policy Committee, and which I and I think everybody else on the call, the presenters on the call belong to. And that's a group of county agencies, nonprofit service providers, and subject matter experts to develop guiding principles, and also to talk about the use of the funds, and very importantly, the oversight and governance structure. We've met 7 times and produced the draft measure framework, which will be discussed today for your input. And I should mention, we're also going to meet again because, of course, we want to distill and incorporate everything that we're hearing from these town halls. There's also been an intensive parallel running needs analysis or systems modeling process, which is a countywide planning effort to understand current resources and identify gaps so that we can right size each piece of the homelessness system of care and achieve an efficient and effective allocation of resources to reduce homelessness over time. And we're going to use this to develop subpopulation specific strategies and guide investments. And last but definitely not least, as I mentioned before, racial equity analysis has to be a huge part of this. We are analyzing the racial disparities in the system and recommending housing interventions to address the disproportionate impact of homelessness on African Americans and Black people, and develop a renewed commitment to deeply affordable subsidies for extremely low-income households. So all of this work together has resulted in the Home Together Investment Plan, and Carrie Abbott's going to review that now in detail. Carrie?
Thank you, Gloria. That's very helpful background on how the Home Together Investment Plan was developed. Again, my name's Carrie Abbott. I serve as the director of Alameda County's new Office of Homeless Care and Coordination. And I'm going to go through the details of the November ballot measure framework and the Home Together Investment Plan. Next slide, please. So the jurisdictional working group met for the first time in January of 2020 and started to discuss this proposed revenue measure. We have since been meeting with mayors and city managers and hosting town halls and provider groups to get additional input. My office, if you haven't heard of it before, is called the Office of Homeless Care and Coordination. It is actually brand new. At the same time, the supervisors asked Healthcare Services Agency and other county staff to work on a revenue measure. They also were working on forming a new Office of Homeless Care and Coordination. The idea behind this office is to improve efficiency and coordination within healthcare with partner county agencies, to support the development of a robust and integrated system of homelessness services, to establish a single triage point of contact for the county, and to build a strong foundation to support potential future resources, such as a revenue measure. The next slide, please. So the Home Together Investment Plan, how will it work? We've committed half the funds already in the county that we need to address homelessness in Alameda County. And the estimate of an additional $150 million a year would fill that gap. Now, we want to acknowledge that the economy has changed since we first started working on this, and our revenue projections may go down. We may not be able to end homelessness with a revenue measure. However, without the revenue measure, we will not be able to make the kind of progress we really need to for people experiencing homelessness. So the measure would be on the November 2020 ballot. Initial allocations would be informed by the needs analysis that Gloria described, and then adjusted with updated modeling as new data become available. We'd have a policy and accountability committee to make annual and multi-year funding recommendations to the county. The guiding principles would be to prioritize housing and interventions that end homelessness. So really focused on ways that people will never have to be homeless again. Promoting racial equity informed by lived experience, encouraging regional and countywide approaches. So looking at what works and using that across the county, working together across our jurisdictions, using data and evaluation to guide the allocations and ensure accountability and efficacy. And we would like to build on our existing infrastructure and planning efforts, so to support what is in place that is working. And the next slide, please. So who will it serve and what will it fund? This slide provides a little bit of an overview of the populations in Alameda County experiencing homelessness or at risk of homelessness and the solutions that are needed to help ensure they remain housed. So the types of populations that we can serve would be families with children, veterans, seniors, people with disabilities, and currently unhoused people living on the street, in tents, vehicles, and in shelters. The funds would be used to provide some care coordination, navigation of services, and housing location. What does that mean? That's for people who are sheltered or unsheltered. They often need a lot of assistance finding a path to appropriate housing. We would also provide assistance for families and individuals who are at imminent risk of homelessness. So those who are most likely to end up homeless should they lose their current housing situation. We could provide additional beds and services in shelters or navigation centers. There could be additional street-based and mobile services for people in encampments and vehicles, including hygiene, sanitation, and health checks. And of course, ongoing housing support. So helping people make up the difference between what they can afford and what our housing market costs. Activities such as the enhancement of our data system so that we are keeping track of what we're doing and whether we're succeeding, and the coordination of our policy and accountability committee. Next slide, please. So what have we learned from our initial needs analysis? We've learned that families and individuals with jobs often need some short-term assistance. We've learned that young people often need support and a subsidy in order to afford some rent. We've learned that extremely low-income families and individuals who can't increase their income may need longer-term support and deeply affordable housing. Seniors and people with disabilities make up approximately 54% of the adult-only households that are homeless or at risk of homelessness. And more than 12% of our population in need are families with minor children. So some things we want to make sure that you understand: the high cost of housing in our community has been pushing more seniors into homelessness. People with fixed incomes and disabilities often cannot afford their rental costs. Additional funds and resources through this investment plan would really help people on fixed incomes who would otherwise lose their homes. Also, that 82% of those experiencing homelessness in Alameda County lived here before losing their home. I know that Supervisor Haggerty also talked about that statistic. It's really important to know that people are often living outside in the very community where they lost their housing. And a reminder that the needs analysis work that we're doing will change over the life of the measure, and we'll continue to monitor and adjust what we're doing in accordance with that. Some of the solutions that additional funding could make possible for these populations: rapid rehousing, so helping people get right back into housing, not having to spend months or years in a shelter or transitional situation. Dedicated affordable housing, so making sure that we have a real stock of housing that people can access from homelessness, and helping make the income sufficient for the housing that's available. Permanent supportive housing is an intervention where we provide deeper supportive services for people who will need some ongoing support and who will need ongoing rental assistance. And then subsidies to keep people housed. So we want to make sure that we're preventing new people from ending up homeless, especially when the rents are still high and incomes are not increasing. The next slide, please. So a few stories that we heard at doing focus groups and from people with lived experience or who are currently homeless as we're crafting this measure. One African-American senior said, "I'm still looking and I'm 2 years into it. Everything is away from the lifestyle I built here. Antioch and other places are miles away. I built a life here for myself and I want to stay here. I want to stay close to my son and grandsons. In 2 years, I've gotten 2 interviews and finding something wheelchair accessible has been difficult for me." We heard from a Native American woman, "Finding an affordable place, especially in Oakland. We're getting pushed out. You got to jump through hoops and find the hoops. I just want to work and go home and live, okay? I just want the minimum. It's not having enough affordable housing. Everyone is looking." And then finally, from an African-American senior, "When I first got my apartment, my challenge was my record because I've been in jail for 20 years. The only way I got in was the subsidy I got through St. Mary's. They had to pay double the security deposit. It made it really hard because they hold mistakes against you. I'm kind of stuck where I'm at because I know it will be a problem if I need to go anywhere else, even though I've completely changed." So the next slide. Home Together, our planning and accountability committee. So it's been really clear to us in doing our initial stakeholder outreach, talking to people who would be impacted by this. They want to understand how the county would be held responsible for spending these funds appropriately. So the planning and accountability committee would have the role of making recommendations to the county for the annual and multi-year spending priorities, would coordinate with the continuum of care, the county and the cities in their planning efforts, would evaluate the status and impact of tax-funded projects, and would certify the annual compliance audit by a third-party independent auditor. The membership, we would be looking for a diverse and it would be inclusive of people with lived experience of homelessness. And the representatives would come from supervisorial districts, cities, county departments, nonprofit providers, healthcare partners, the continuum of care, and affordable housing developers or local businesses. I'm now going to pass along to Sharon Cordew, Executive Director of St. Mary's Center, who will talk about our timeline, and then we'll come back to questions and answers.
Hey, Carrie, real quick, can I just say something?
Yes.
I just wanted to acknowledge that Mayor Marchand from Livermore is on the line. He appears to be the only mayor out of my district that has taken the time to be with us tonight. I notice he also has one of his staff assistants on too. And I just want to acknowledge that because Mayor Marchand has been a leader in homeless services out here in the Tri-Valley, and just thought he should be acknowledged.
That's great. Thank you, Supervisor, and welcome, Mayor.
Great. Thank you very much. Hi, this is Sharon Cornew with St. Mary's Center. And I want to thank our earlier presenters tonight. St. Mary's Center has been part of the policy and planning group along with the BODE, BACS, and Building Futures. And we want to share with you on this slide some of the process that has gotten us to this point. As Carrie and Gloria Bruce spoke about, there have been plans underway with everyone home in the new office, some good systems modeling and needs analysis to look at programs that work and make a difference and what we need to be doing in Alameda County. And that took place in 2019 and leading into January and February. In March of this year, St. Mary's hosted a breakfast for service providers. And then we got the shelter-in-place order, and the wonderful community engagement plan that we had worked on got disrupted. And we began to look at other ways of talking with folks. We hosted a conference call on March 31st, and through April and May, now with the 3 virtual town halls. We've been seeking public input. I think at the first town hall, we had 130 participants. The second had 60 to 70. And tonight, as Supervisor Haggerty mentioned, we have a mayor on the line and more than 40 other participants. So we've reached a lot of people through this. There's something to this virtual town hall format. We do anticipate moving forward in June and July to first and second readings at the Board of Supervisors so that this measure can be placed on the ballot for November of 2020. Now we're going to get to the most important part of the evening. The next slide, please. Questions and answers. And I'll just share with you how you can make your voice heard. If you are teleconferencing in on a computer, you can use the button at the bottom of your screen to raise your hand and request to speak. And the moderator will call on you. You'll need to unmute your microphone. Tell us your name and the city that you're calling from, and we'll be eager to hear your question or comment. If you're dialing in on a phone, just dial *9. That's *9 and raise your hand to speak. When you're called on, the host will automatically unmute your mic so that you can ask your question or make your comment. And if when the turn comes to you, your question has already been asked, you can just pass or lower your hand and let the host know. We do have a hard stop tonight. We hope to be able to get to all of the questions that people have, but at the end of the presentation, we'll have some information about other ways you can share your thoughts and ideas. And so with that, I think we can go to questions and answers. And do we have someone? And here's the
Yes. Go ahead, speaker. You're on the line. Please unmute your mic.
Greetings. It is Mayor Marchand.
Oh, hi there. Can you hear me?
Yes.
Okay, very good. Thank you. Great presentation. I've actually been involved in all those leadership meetings working up to this, and happy to see this progressing as it is. The Tri-Valley does not have the access to the density of services that, say, Central and North County have. But one of the questions that I have is there going to be a return to source component, some sort of base funding for local regions that are providing sales tax toward the measure?
Hi, Mayor. This is Carrie. So the concept for us is to base the allocations based on where there are people experiencing homelessness. And as we know, that businesses that would be collecting a sales tax are not always in the same place where people are experiencing homelessness. So we would intend to allocate the funds according to where there's the highest need, but making sure that we also have interventions that can serve people countywide, to make sure that we're not missing a segment of the county or of our geographic region. And as you know, we are trying hard to focus on people experiencing homelessness in the Tri-Valley area right now, where services are definitely greatly needed.
That was the last person we had for questions. If there's an, oh, it looks like there's one more other person. Just a moment, please. Speaker, go ahead.
Hi, this question is for Supervisor Haggerty. I'm wondering how he thinks we can continue to build the support to end homelessness and build affordable housing in East and South County in particular. Like how do we make this successful, in his opinion?
Okay, good. Sorry, I was having a hard time getting off here. You know, I think that in a way, Mayor Marchand kind of touched on it. I don't think that at times my colleagues understand the tremendous problem that, say, for example, exists in Fremont and Livermore, and sometimes fighting for resources to house people can be extremely difficult. So, I think, first of all, it's an acknowledgement that there is a tremendous amount of homeless veterans down here. I remember that for many nights I saw this guy sleeping in his car, and one day I approached him and talked to him, and come to find out he was a veteran, and the only thing he could afford to put his belongings in a storage shed, but he couldn't afford to have a home himself. I was able to get him with the proper people that were able to find him housing, so it was a great success story. I think we need to continue street outreach, continue to work with the community. The mental health problem in Fremont is exploding. And not to say it's not a serious crisis in Livermore also. I think we need to continue to work with the Measure A1 monies, build the facilities necessary. I'm currently working on a tiny home project in Livermore with Livermore and a faith-based organization, and also have committed funding to a project that Livermore is doing. And I don't know if Mayor Marchand wants to get on and talk a little bit more about it, but it has wraparound services that will, continue to work with the clients once they get into housing. So I think it's kind of a alphabet soup. I think that really once you get people into housing, the services that you can then provide to make sure that can be permanent are extremely important. Whether it's veterans or even mental health people or women with children or youth. So I think it's kind of an alphabet soup. I think A1 was a great thing, working with Fremont to build the Islander Hotel and get that ready, HEAP funding. So I just think there's so much out there, and we just have to continue to realize there's a problem here in South and East County. And to that end, I would point out that I have hired somebody that's her job. Anna Olivia Allred is a phenomenal addition to my staff, but her focus is homelessness. That's it. Working with the cities, getting the services that the cities need to be able to end this crisis that we have in Alameda County. I hope that answers your question, but I think the bottom line of that is it is an alphabet soup. It's going to take a lot of everything.
Okay, next speaker, you're on the line. Please unmute your mic.
Hello, can you hear me?
Yes.
Hi, this is Mark Elgood. I'm from Livermore. I do a lot of work with homeless outreaches. I actually did the showers at Asbury today. So this is the first time I've heard about this effort, and it certainly sounds very good. I'm tied in with most of these activities, but just speaking as a devil's advocate, I'm not sure what additional information is available at this stage, but it just, obviously understanding how the funding source this will provide then ties in with other funding sources and what the vision for what this can achieve. I think you're going to have to do a lot of work to put that together in graphics and other forms that people can understand and start to get behind this. It just sounds like at the moment a big request for money without really a lot of additional information that may exist that I haven't seen yet about how you're going to then sell this as a longer term solution.
Thank you. Yes, we have a draft policy framework, and we've kept a lot of records on how we've come to these policy decisions, along with the information, the background information on homelessness and the resources we need and what's already in our system. Once the supervisors choose to put this on the ballot, once we've incorporated the initial stakeholder input, we will be making those materials widely available and hopefully promoting them widely as well. Thank you.
Okay, next speaker, you're on the line. Please unmute your mic. Speaker, you're on the line. That was the last of our speakers.
Well, we should ask at this point if there are any more questions, or we've had a pretty short queue. I thought I saw Mayor Marchand come back into the queue. I don't know if he had a follow-up question. Looks like we do have a couple more questions.
And thank you, Supervisor Haggerty, for mentioning Vineyard 2.0. We are very excited about our collaboration on that, as well as the tiny homes, especially with Vineyard 2.0 that does include the wraparound services that are so critically important to long-term success. When you mentioned that the businesses that provide the sales tax are not where the homeless are, I was concerned because, as you know, there was a significant problem with the pit count in Livermore, which resulted in a significant undercount. So that continues to concern my community as we move ahead with this, because if there is not some sort of floor or base return to source, if those numbers are based on an inaccurate pit count, that just shows that the cities in the Tri-Valley region are going to be underrepresented.
And yes, I agree that there were concerns with the point in time count, and this new work would be based on the 2021 pit count. We're already starting our planning and would love to have Livermore and other cities participate in that planning effort to make sure that we don't have the same kinds of things where people feel like we're missing really important areas and involving people in the local communities. Thank you.
Next speaker, you're on the line. Please unmute your mic.
Hi.
Okay.
Hi, my name is Michaela. I'm currently reside in the city of Oakland, and a concern I have always had in regards to helping out with the homeless situation is basically like when they say we're charging the state, taxes and stuff. The way the money is actually allocated and actually used, because I've heard many stories of, I guess, money not properly being used for its original intention. So do you know any way that you would resolve to make sure that the money is actually being used properly?
If I could, Carrie, let me take a stab at this, and please, you and Gloria can fill in. Maybe we can take the slides back, if we could, just to slide 16, and take a quick look at that Planning and Accountability Committee that Carrie walked us through a little earlier. One more back. Perfect. Oh. Slide 16.
I have that as slide 18, Sharon.
I'm sorry. Okay. It's the one that says Program and Accountability Committee. There it is, slide 18. Thank you for the correct number. And I think here, Ms. Michaela, you've asked really the core question about how government and community work together and what accountability looks like. So this committee is important to me because it speaks to having not only an audit capacity looking backwards to make sure that money has been spent properly, but it also takes into account the planning and accountability going forward. So this group of people, including folks with lived experience of homelessness, as well as representatives of the city, the county, the nonprofit partners, healthcare partners, would be able to identify best practices and needed programs and resources and be able to make those recommendations to the county supervisors so that a complete and comprehensive program was put in front of them with clear reporting and with standards and benchmarks about how outcomes would be measured. And this, I think, is a really exciting and important part of the measure that speaks directly to the concern that you and others have raised. Did I answer your question? And Gloria and Carrie, is there more to add there?
Sharon, I think that was great. And for those on the phone, this is Gloria Bruce again. I'll just add something. Michaela, thank you for your question, because it is so important. And I think it's on a lot of people's mind. As Sharon said, it's been a major part of the discussion to develop this. And, you know, I'm someone who's been in a lot of these meetings and who knows the people working on this in the county. And so I have a lot of trust that they care deeply and are going to put that money to good use and are going to, you know, follow all, you know, cross all the T's and dot all the I's. But for the average Alameda County resident, taxpayer, et cetera, which I also am, who isn't dealing with these folks day by day, you might say, well, how do we know? And so that's why those structures that Sharon put in place are so important to build up that trust. I'll just mention that I'm a member of the Measure A1 Oversight Committee for the county. That's that tax measure, the revenue measure I mentioned that was passed a few years back. And we have a committee that has a pretty great makeup of people representing all different constituencies and walks of life, looking to make sure the money is being spent. And what I can tell you is that money absolutely is being spent. It's building housing, it's getting out the door, and it's so critical to have a public body to look that over. And so I'm really glad that we're thinking about how to do that from day one with this measure. And I think it'll increase a lot of confidence, which people should have, because the people working hard on this are definitely have everything in the right place. And it's just making sure we know how to communicate to the public that we do have that oversight and that governance in place.
Thanks.
Okay. Speaker, go ahead. You're on the line.
Hi, my name is Edgar Alvarez, and I'm calling in from Oakland. And I'm calling because I see that by raising the tax for ½ cent, we're increasing it about $150 million. Is that correct? I think I saw that on slide 16.
Yes, that's the original projection. Now we know that our economy has changed somewhat in the last month. So undoubtedly that number will be re-estimated.
Okay. And the reason why I'm mentioning that is because I'm aware that the sheriff of Alameda County is asking for 318 million requests. And I was wondering if I know there's a vote tomorrow for Scott Haggerty to vote that. So I think it would be best for Alameda taxpayers to be able to focus on more on the public health crisis and invest those that money in more in for housing and health care, as I think that would be best for the community than rather focusing on investing 318 million on hiring new deputies and jail staff.
So thank you for your comment. The discussion tonight is about this proposal for the Home Together investment plan and a measure that would move forward on the November 2020 ballot to create an ongoing source of funding for homeless services programs.
You know, Sharon, I want to take a stab at that. I don't like to shy away from things. I would just say that, you know, I've been a county supervisor for 23 years, and I'm winding down to somewhere around, I think, 250 days. But not that I'm counting or anything, but till my retirement. And I can tell you that one of the greatest things about being a county supervisor is we don't just work on one thing. We have many issues that confront us on a daily basis. I've done anything from transportation to homelessness to Elon Musk today. So it's been a very exciting day, and you know, the county supervisors deal with many issues.
Thank you to our caller and to Supervisor Haggerty. Do we have more questions in the queue?
No, that's it.
Okay, great. Well, thank you. If you would take us to the next slide. There are still more ways to be involved and to get more information. This slide shows you that you'll be able to answer questions in a survey if you've registered for tonight's town hall. That survey will be emailed to you immediately after the close of the town hall. The materials, including the slideshow that you've seen, will be posted to Supervisor Haggerty's website, as well as the homelessness.org home.acgov.org website. And the recordings of last week's virtual town hall meetings will be posted to those supervisors' websites. So you'll have a chance to go back and watch them again. Maybe the easiest way to be involved, though, if you have a question, a concern, or an idea, would be to email the hometogether@acgov.org email address. And I know that input from those from that email is being incorporated into the plan as it's being built out further and finalized. And with that, I want to offer Supervisor Haggerty or Carrie Abbott or Gloria Bruce an opportunity to share some closing remarks.
I have none. I want to thank those who participated again. Thanks to Mayor Marchand for being on, and thank you. He stole one of my great employees, Josh Thurman, who I also noticed was on, and he did my healthcare, social services, and homelessness. You know, this is a difficult problem. It is exploding all over the state and all over the country, and it's going to take swift, bold action. And it's going to have to come from all fronts. As I talked about earlier, it is an alphabet soup. It's not one thing will solve this problem. It's going to be a myriad of issues. And once we continue to find solutions of getting people into housing and then also providing the wraparound services and the mental health services that people need, and even addiction issues that we talk about. So it will come from us from all sides, but I know this community is up for the challenge.
Thank you so much, Supervisor Haggerty. Thank you, Sharon, and thank you, Gloria Bruce. And especially thanks to all of those of you out there who took time out from your evenings to come and hear what we are working on. We will bring back your voices either through the online submission or from what we heard tonight. We so much appreciate all of you, and we look forward to hearing more soon. Thank you.